So I was reading through the news and saw the report of this young lady's death, whose name is Anna Cardwell, and she is the daughter of Mama June, who is well-known reality TV star. So reading through the article, I see that she had passed from adrenal carcinoma, or what we call adrenal cortical carcinoma. This is a very rare tumor, but it gives us an opportunity to look at the anatomy here, why this tumor is such a problem, and talk about it a little bit. So this morning while I was having coffee, I decided to do another sketch because I kind of enjoyed drawing that yesterday. If you didn't see my pancreatic anatomy video, you can go watch that. So let's review the anatomy here. This is the abdominal aorta, and I have to give a disclaimer that I have not drawn in the arteries that come off here anteriorly. The celiac trunk comes off here, superior mesenteric artery comes off here, but for simplicity's sake, I did not include it in this drawing. Inferior vena cava, and I drew it as a cutaway because inferior vena cava continues this way. And then this is the renal artery. This is the suprarenal artery. So sometimes the adrenal gland is referred to as the suprarenal gland, supra meaning on top of, renal meaning kidney. So adrenal, it means the same thing. This is the adrenal gland here, of course, the kidney, and then this is the ureter. So the adrenal gland is a pyramidal-shaped gland that sits on top of the kidney. It's about 4 or 5 centimeters in maximal dimension. And it is a place where tumors do commonly form. However, most of those tumors are usually benign. They're usually things like adrenal adenomas. Now, in the center of this gland is the medulla, and that is where the cells that make epinephrine and norepinephrine are, and when a tumor arises there, it's called a pheochromocytoma, but we can talk about that another time. We are talking about the adrenal cortical carcinoma because the cortex cells are the cells that are on the outside, the medullary cells are the ones on the inside. So why is this tumor such a problem? Well, it has to do with the fact that everything you're seeing here is in what we call the retroperitoneum, meaning it's behind the abdominal cavity. So the intestines are actually sitting where my fingers are, and there's a lot of room for adrenal tumors to grow without being detected. In the body, on the right side of the body, the liver is actually right on top of this. So if an adrenal cortical carcinoma starts to grow, it can grow upward into the liver. It can spread to the local lymph nodes in this area. It can also spread to the portal lymph nodes by the liver. It can grow downward into the kidney, but importantly, there's just a lot of fat that invests the kidney and invests the adrenal gland. This drawing is an idealized drawing, but in reality, this is all fat, and then you have to dissect the fat away. So the point is, there's not much resisting growth of a malignant adrenal tumor. And as such, they are very well known to grow to very large sizes and be metastatic by the time they are found. They are usually found because they are producing symptoms related to hormone production in the tumor itself or local invasion into structures, which causes, things like abdominal pain and other symptoms that warrants imaging. So this tumor has always bothered me ever since I was a resident in pathology. We saw them very infrequently. They're present in about 1 in 1 million people. So every year in the United States, there's actually about 200 to 300 cases, and they have poor prognosis. Most individuals, I think average survival is around 2 years after diagnosis. And this can occur at any age. And the frustrating thing about this one, the reason why this kind of tumor bothers me, is that there really aren't significant risk factors. Most of these tumors arise sporadically. Obviously there's going to be an association with things like carcinogens, exposures to certain chemicals that can cause cancer. And about 10 to maybe 15% of these are actually genetically related. So there are syndromes like Beckwith-Wiedemann syndrome and things like that, which can have association with adrenal cortical carcinoma. But in general, this is what I, as a pathology resident, would always think of as kind of a bad luck tumor because they can arise seemingly out of nowhere, and by the time they're found, there's really not a lot you can do. And similar to the discussion we've been having on pancreatic cancer, there's not an easy screening or an easy blood test you can do to test for adrenal cortical carcinoma. This one would be detected if you were to see it before you had symptoms. It would be an incidental finding on something like a CT scan or an MRI. And just as a side note, I had a lot of people, talking about CA 19-9 in my other comments on pancreas videos, on the other pancreas videos. And I try to respond to as many of those as I can, but a lot of times, I just don't get to everybody's question. CA 19-9 is a decent marker to follow. If somebody has a pancreas cancer diagnosis, you can draw those every few months and see if the, tumor burden might be going up or something like that. But it's actually not a great screening test for people, for the general public to get, because some people can have pancreas cancer and low CA 19-9. That's why it's not tested on every single person that comes through the door when they turn 50.